welcome all to the workshop how to identify rare disease patients. So today I've just got a brief 10 minutes here for myself. I'm just going to introduce Findacure, because we've got a lot of new faces in the audience, and then give you a bit of an update about our 2014 workshops, which was our pilot version of these training workshops and some of the feedback we've gotten. So to begin, let's Findacure. So Findacure, we're now a sort of 2-year-old organization. We're very much focusing on building the rare disease community. And the ways that we do that is firstly, we're empowering patient groups. So that's through things like our training workshops. We've got a peer mentoring program. And we've also got a couple of new projects for this year that I'll mention at the end. We're also looking at facilitating the development of treatments. So we're looking to set up a new program in which we'll be repositioning existing generic drugs for treatment of rare diseases. And the third thing is we're trying to campaign for a more receptive research environment. So I'm sure I don't need to tell you all that rare diseases tend to be quite overlooked by scientists and academics. And so what we're really trying to do is raise awareness of rare diseases and get a lot more engagement. So to do that, we do an annual scientific conference, and we've actually got our next one coming up in February. If any of you are interested, let me know in the break. And also, we have started to run a national medical essay competition for students to really engage the next generation of doctors and researchers in rare diseases. And so part of this raising awareness is a new term that we've come up with, which is fundamental diseases. So we found that when we've been trying to raise awareness about rare diseases, people tend to shut off the moment they hear the word rare. They just think, if it's so rare, why should I care? And we've actually looked into it quite a bit, and there's a lot of scientific basis that rare diseases are actually very good gateways for understanding common conditions. So by studying the rare, we understand human physiology and different aspects of common conditions a lot better. And to really summarize that in a term, we've come up with this term, fundamental diseases. So some examples for you, alkaptonuria, it's an ultra-rare disease. It's from a buildup of acid in the body. It causes bones to turn black, causing quite bad breakdown. And that's actually been found to be an accelerated version of osteoarthritis. And it's actually led to the research showing that there's different bone structures that form in osteoarthritis, and that was only done through research into alkaptonuria. Another example is progeria, which you might know it's an aging condition, causes extreme aging in small children. And studying that has actually revealed quite a lot about the process of aging, why certain systems break down with age, and it's quite an exciting area in science at the moment to discover all the things we are learning from progeria about aging. So we really hope that you'll start to use this term amongst yourselves as well to really build this community of the importance of rare diseases. And now I just briefly want to give you some feedback that we've gotten from our workshops. So in 2014, we piloted this whole idea of offering training workshops for patient groups about various topics and really trying to give practical advice that attendees can go back home and immediately use. And so in 2014, we did 4 workshops, and here's just a little infographic I put together about the feedback we received. So we had 124 people attend all of them in total, and there were 25 repeat attenders, and I see a few of the faces here that came to all of them, which is quite nice. And from feedback forms, we've estimated that that means those 124 people represent about 75,900 patients around the UK and some internationally as well. And in the feedback, there's just very positive comments. So you can see the numbers: 92% believed the workshops were relevant, 90% overall thought that they increased their skills and knowledge, and 100% all said that it was leading to a stronger community. So we're really pleased with these results, as you might imagine, and it's meant that this is going to be a project we're going to continue this year, and it's going to be a key part of Findacure's work from now on these training workshops. The reason for that is another question we asked is how many people know of other organizations doing a similar thing, and overwhelming majority was no one knew of anyone else. And the 33% who did, most of those are people like Small Charities Coalition, NCDO, so people who aren't focusing on rare diseases and helping rare disease patient groups set up. So we're really going to keep looking into this area and try and see how we can offer better support. And so this is how we decide on topics for our workshops. So the reason we're all here, difficulty locating patients. We've done workshops on managing patient groups, on increasing information through clinical trials and engaging research, lack of funding. So if any of you are interested in that, those are all on our website. And hopefully our next workshop will be on lack of public interest and how to run communications and PR campaigns. Okay, and finally, just our plans for 2015. We are publishing a book, hopefully in the next few months, which will really be a toolkit guide on how to get, as a patient group, how to get involved in drug development. So we'll analyze different aspects like the regulations, how to contact academics, how to manage your patient group properly, all of these things to really act as a guide to helping you through that. This will be supplemented by another thing we're trying to launch this year, which is an online portal of information. So this will be a lot of guides from our workshops, guides that have been written on the book toolkit, and it will really be a hub of information specifically geared towards fundamental disease patient groups about how to do various aspects of running and supporting patients. And finally, this is a new project as well. We're looking to get involved in crowdfunding and directly help patient groups in generating funds for new projects. So if you're interested in any of these projects, just come and talk to me in the break. And just to conclude, this is what I always like to conclude our workshops, my presentation with, is this thought to go forward, is to treasure your exceptions, for us to treasure rare diseases and really focus on how we can improve the lives of patients in the UK and worldwide. Thank you.